Hello, it's Dr. Rhonda Johnson. Today is Wednesday, August 3rd, 2022, and today I'm discussing an issue that's important to my heart: orphan children from COVID. Well, we all remember sometime around May 17th of this year, the deaths of COVID-19 reached 1 million in this country, a tragic milestone that we may all want to forget. I know we don't like to talk about people dying from COVID, even though we continue to lose anywhere from 300 to 450 people every day in this country on average. And some of these deaths are among parents of children under 18. I don't have any recent statistics, but in April, an article in the Atlantic magazine said that the number of U.S. children who were orphaned from COVID was around 200,000. And it's probably a little more since April. Now, according to the Atlantic article, the pandemic is responsible for 1 out of every 12 orphans under the age of 18 here in the United States. And in every public school in the United States, on average, 2 children have lost a caregiver to the pandemic. Now, why should we care? Because experts saying that losing a parent or caregiver increases the risk of mental health problems, physical health problems, teen pregnancy, sexual violence, and family economic hardship. And then you add up the toll from the grief and loss and how that can impact school performance and future earnings and productivity. In the Atlantic article, the author states that orphans are at increased risk of substance abuse, dropping out of school, and poverty. And sadly, they are almost twice as likely as non-orphans to die by suicide. Which brings me to wonder who is advocating for these 200,000 American orphan children from COVID. Who are protecting them? Perhaps you have answers that I don't have. Now, we know that men have been hit very hard by this pandemic, and your risk of dying from COVID is higher just because you're male. So to all the dads, the fathers, the uncles, the stepdads, the grandfathers, the bonus dads, the mentor dads, men, your children, your family, and your communities desperately need you. You know, there is something out there that can greatly reduce the chance of your dying from COVID. It is called the COVID vaccine. It's highly effective at preventing death from this virus. It's true, it doesn't stop you from getting infected, and the immunity conferred by the vaccine wanes over time, so the boosters are needed. But here's the reality: COVID is here to stay. It's so not over. The virus keeps mutating, and each new variant keeps on killing people, including healthy people who are in the prime of their life. Parents of children under 18, if you are not dead, your children won't be orphans. It's a very simple concept. Now, ladies, sometimes we can influence the men in our lives, and it's never too late to get a COVID vaccine. And just maybe you can help. You know, the COVID vaccines are free. You can still get them at most retail pharmacies and health centers. You don't need to wait, because right now, most communities in the United States have a whole lot of COVID in the indoor air and in the outdoor air. The virus is literally here, there, and everywhere. So that's my message. I don't like talking about deaths, and orphan children are just one of those heart topics for me. So have a great day, folks. Be safe. Ladies, do whatever you can to get the men in your life to be vaccinated. There is a gender gap when it comes to COVID vaccines. Women are more likely to be vaccinated than men. Take care, folks.